The RELY study was designed to test 2 doses of dabigatran against usual care with warfarin in a randomized clinical trial.
For the prevention of stroke linked to atrial fibrillation, an alternative to warfarin has been awaited for many years, and during ESC 2009, the results of the RELY study opened up new perspectives on this. RELY compared 2 doses of dabigatran, an oral direct thrombin inhibitor, with the current standard therapy warfarin in more than 18,000 patients with atrial fibrillation. The results presented in Barcelona by Stuart Connolly were simultaneously published in the New England Journal of Medicine.
Both doses of dabigatran offer significant advantages over warfarin. The higher dose, 150 milligrams, is more effective with a similar rate of major bleeding and reduced other types of bleeding. The lower dose of dabigatran is similar to warfarin in terms of reducing stroke, with a much enhanced safety profile in respect to bleeding.
In Europe, 14,000 atrial fibrillation ablations are performed every year. During ESC 2009, Josep Brugada highlighted the challenges to come.
In Europe, there are more or less 4 million patients with atrial fibrillation. Now, we are aiming at the population of a rather normal heart and with good chances to cure them. So this is a population of young people with paroxysmal AFib. On the second hand, we also want to help the patients that do have heart failure. Here, we are talking about maybe 20 to 25% of the total amount of patients with atrial fibrillation. So we are talking already about millions.
At ESC 2009, Salim Youssef reported the results of ACTIVE-I, in which over 9,000 patients with atrial fibrillation and at least one risk factor were randomized to receive irbesartan or placebo for 4.1 years. There was a difference of 3 millimeters of mercury in systolic blood pressure between the groups, and the primary outcome of cardiovascular death, heart attack or stroke was unchanged, but heart failure endpoints added a positive trend.
We had a reduction in heart failure of about 16%, which was statistically significant. And in addition, there was a non-significant trend towards reduced strokes. So it means there is a useful, modest benefit that we should consider on top of antithrombotic therapy.